So what are some of the realizations or the comments that you have from your healthcare professionals at the end of your workshops or your discussions where they've just suddenly had, you know, massive more amounts of realizations than I've just had in this couple of minutes, but they've had a whole day of you?
Well, you know, a lot of times health professionals are a little bit conservative about criticizing themselves or realizing that they have to learn more. They, first of all, they say that they want to be trained more. That's one thing. They want more of it. So this is good. I do, of course, keep statistics, and 82% of them claim that their sessions with their patients favorably change. So they start using these techniques and they realize how they get more information, more involved with their patients, and that's good. And because I also do that to students as well, like medical students and dietetic students, they definitely think that this is something that needs to be included in their academic curriculum. So they need to learn about it as they study before they get their degree. So because one interesting thing that happened to me once is that I went and I did a workshop to medical students, and I knew many of their professors. And as I was doing the workshop, I realized attitudes from their professors in them. They were behaving like their professors, and that was so interesting. And then when I was discussing that with my mentor, he said, yes, because remember that when you learn in an institution, in a university, you don't only get knowledge, you also learn attitude. And that was very interesting because, you know, in Greek, you know, I'm Greek, and we have a proverb that says, with whichever teacher you sit, that's the education you're going to get. So they actually start to imitate their professors in their attitude. So I was thinking at that point, oh, so this goes from generation to generation? Okay, I have to fix this. So, and then I realized once we started doing the workshop that how each and every student started bringing out their own personality, you know, and that was wonderful. They didn't have to imitate.
And did they notice it and comment at all on themselves? Did they start to see that?
Yes. And some of them were even aggravated, which is part of the whole deal, you know, because they sort of, you know, they had an ego, they were graduates, they thought that was it, we have it all. And then all of a sudden, this dietitian came along and, you know, pointed out a few things. But it was all for the best. It was also, you know, for good purpose.
Very much so.